They never told you this. Struggling through a full cleaning routine every single week might be doing more damage to your joints, your energy, and your independence than actually leaving some of the mess. I know that sounds like something no doctor should say out loud, but after years of treating older adults with arthritis, chronic pain, and limited mobility, I've watched people injure themselves far worse trying to scrub a bathtub than they ever would have from a little extra dust. I'm Dr. James Carter, and today I want to give you 10 cleaning hacks that are, quite honestly, a little lazy and remarkably effective, specifically designed for bodies dealing with pain, disability, or the simple realities of aging joints. Here's a number that should change how you think about housework entirely. Research on activity-related injuries in older adults has found that a significant share of home injuries requiring medical attention in people over 65, in some studies estimated at nearly 30%, occur during routine household tasks like cleaning, reaching, bending, and lifting, not from dramatic accidents, but from ordinary chores done the wrong way. 30%. That means the vacuum cleaner, the mop bucket, and the step stool in your closet may pose a genuinely higher risk to your body than most people ever consider. And here's the one I want to tease right now because I think it'll genuinely surprise you. It's item number 2 on today's list, and it involves a piece of equipment sitting in nearly every senior's home already, completely unused, that can cut your cleaning effort by more than half while actually reducing strain on your joints rather than increasing it. Most people have no idea it exists for this purpose. I'll explain exactly what it is when we get there, so stick around. Before we dive in, I want to ask you something, because I read every single comment on this channel, every day. Tell me, how old are you right now? And what's the one cleaning task in your home that causes you the most pain or the most dread? I read every comment and it genuinely shapes what I cover in future videos, so please don't hold back. Alright, let's count it down together. 10 to 1, from helpful to absolutely game-changing. Number 10. Stop kneeling on hard floors to clean low surfaces and start using a long-handled tool instead. Let me tell you about Frank, 74, from a small town outside Tulsa, Oklahoma. Frank came into my office after a scrubbing session under his kitchen cabinets left his knees swollen and painful for nearly a week. He told me, almost sheepishly, that he'd always cleaned that way, and it had simply gotten harder to recover from as he got older. Here's what's happening physiologically. Kneeling on hard surfaces places direct, concentrated pressure on the small fluid-filled sacs around your knee joint called bursae, and repeated pressure can trigger a painful inflammation known as bursitis. This becomes especially problematic after 70, when cartilage, the smooth cushioning tissue inside your joints, has typically thinned by a meaningful margin compared to your 30s, offering far less natural padding against this kind of repeated mechanical stress. Additionally, getting up from a kneeling position requires a fairly demanding combination of leg strength and balance, exactly the kind of movement that becomes riskier as muscle mass and balance reflexes decline with age. The fix is refreshingly simple. Replace kneeling tasks with a long-handled scrub brush or an extendable microfiber duster, tools originally designed for reaching high places that work just as well for low ones. For baseboards, under cabinet areas, and low shelving, an extendable handle lets you clean from a standing or seated position entirely, eliminating the kneeling and rising motion altogether. For preparation, keep one long-handled tool in each major room, rather than storing everything in one closet, so you're never tempted to kneel simply because the right tool is inconveniently far away. For synergy, pair this habit with a rolling stool or wheeled seat for any tasks that genuinely require getting low, like reaching deep under furniture, allowing you to sit rather than kneel while still getting the job done. Number 9. Stop lifting your full vacuum cleaner up and down stairs and start using a lightweight, cordless handheld instead. Eleanor, 79, from a suburb of Sacramento, California, used to carry a heavy, old-style upright vacuum up and down her stairs weekly, until a particularly rough day left her back in spasms for nearly 2 weeks. She told me she hadn't even considered that the vacuum itself, rather than the vacuuming motion, might be the actual problem. Here's why this matters so specifically for an aging spine. Carrying an awkward, heavy object while navigating stairs combines 2 significant risk factors simultaneously. Spinal loading, meaning direct compressive pressure on the discs between your vertebrae, and reduced visual feedback since you're often looking at your feet rather than freely at the object you're carrying. After 65, spinal discs have typically lost a meaningful percentage of their water content and cushioning capacity compared to younger adults, a natural process called disc degeneration, meaning the same lifting task that was manageable decades ago now transmits more force directly to vulnerable structures in your lower back. The fix is simply switching equipment. A lightweight, cordless, handheld vacuum, many of which weigh under 5 pounds compared to 15 or 20 pounds for a traditional upright, dramatically reduces the load you're carrying and can typically handle stairs, upholstery, and small messes just as effectively as a full-size machine for most everyday cleaning needs. For preparation, keep the handheld charged and stored on the main floor you use most, so it's always within reach without requiring a trip to fetch it from a closet. For synergy, pair this with a simple stair rail habit. Always keep one hand free on the railing while carrying anything up or down stairs, treating this as a non-negotiable rule rather than an occasional precaution. Number 8. Stop scrubbing the bathtub by hand and start using an extended squeegee with a daily 1-minute habit instead. Vincent, 71, from a small community outside Phoenix, Arizona, dreaded his weekly bathtub scrub more than almost any other chore, describing it to me as leaving his shoulders and lower back aching for days afterward. The repetitive scrubbing motion, combined with an awkward, bent-over posture, was doing far more damage than the actual dirt buildup ever could. Here's the science behind why this particular task is so hard on aging bodies. Scrubbing motions require repeated flexion and rotation of the shoulder joint, combined with sustained forward bending at the waist, a posture that places significant strain on the muscles supporting your lower spine. Researchers studying musculoskeletal strain in repetitive household tasks have found that sustained forward bent postures, maintained for even a few continuous minutes, can meaningfully increase pressure on lumbar discs, the cushioning structures in your lower back, compared to more upright working positions. The fix involves 2 changes working together. First, use a long-handled squeegee to wipe down bathtub and shower walls immediately after each shower, while you're already standing there, taking less than 60 seconds and preventing the mineral and soap buildup that eventually requires heavy scrubbing in the first place. Second, when deeper cleaning is genuinely needed, use a shower cleaner spray with a long-handled scrub brush rather than a handheld sponge, keeping your back straighter and your shoulder working through a shorter, more controlled range of motion. For synergy, pair your daily squeegee habit with a bathroom exhaust fan run for 15 to 20 minutes after every shower, which reduces the moisture that leads to mold and mineral buildup in the first place, meaning you'll need far fewer intensive scrubbing sessions overall. Number 7. Stop bending over the sink to hand wash dishes and start soaking strategically instead. Dorothy, 76, from a quiet town outside Portland, Oregon, described standing at her kitchen sink scrubbing pots as one of the most painful parts of her day, particularly affecting her lower back and her hands, which had developed some arthritis in recent years. Here's why standing dishwashing is so taxing on an aging body specifically. Standing in a static, slightly forward-leaning position for extended periods, as most people naturally do at a sink, requires continuous low-level contraction of your core and back muscles to maintain balance and posture. Unlike walking, which involves natural movement and blood flow, static standing can lead to muscle fatigue and stiffness more quickly, particularly after 70, when muscle endurance capacity has typically declined due to a natural reduction in the efficiency of mitochondria, the tiny energy-producing structures inside your muscle cells. Think of mitochondria as the power generators inside a factory, and as they become somewhat less efficient with age, sustained muscular effort simply becomes more tiring, more quickly than it used to. The fix is what I call strategic soaking. Rather than scrubbing pots and pans immediately after cooking, fill them with warm water and a small amount of dish soap, and let them sit for 20 to 30 minutes, or even overnight for particularly stuck-on messes. This allows the soap and water to break down food residue chemically, meaning far less scrubbing effort is required afterward, often reducing a 5-minute scrub to a 30-second wipe. For preparation, keep a sturdy stool or high chair nearby so you can sit while doing any remaining light scrubbing, rather than standing the entire time. For synergy, pair this habit with fingerless compression gloves, which some patients with hand arthritis find helpful for reducing joint strain and improving grip comfort during the final rinsing and light scrubbing steps. Now, before we get to the final 6 items, the ones I genuinely think matter most, if you're finding this helpful, please take a moment to hit subscribe and tap the like button. It really does help this information reach more seniors and their families who need it, and it costs you nothing. Thank you to everyone who does this. Now, back to the countdown. Number 6, stop carrying cleaning supplies from room to room, and start building a stationed caddy system instead. Walter, 77, from a farming community in Iowa, told me he often felt exhausted before he'd even really started cleaning, simply from the repeated trips gathering supplies from under the kitchen sink and hauling them through the house. Here's why this seemingly small habit matters so much physiologically. Every unnecessary trip carrying a heavy caddy or bucket represents an additional round of joint loading and energy expenditure, and aging bodies operate with what researchers sometimes describe as a reduced energy reserve, related in part to natural declines in cardiovascular efficiency and muscular endurance after 70. Think of your daily energy capacity like a bank account with a smaller daily balance than it used to have. Every unnecessary withdrawal, like an extra trip up the stairs for supplies, leaves less in reserve for the tasks that actually matter. The fix is building 2 or 3 small, lightweight caddies, each stocked with basic supplies, one for each level of your home or major cluster of rooms, so you never need to carry a single heavy set of supplies throughout the entire house. A simple caddy with an all-purpose spray, a microfiber cloth, and a small brush covers the vast majority of daily cleaning needs without requiring you to fetch anything from a distant closet. For preparation, keep each caddy genuinely lightweight, prioritizing multi-purpose products over single-task items, so you're never tempted to carry more than necessary. For synergy, pair this with a simple daily reset habit. 5 minutes each evening wiping down the kitchen counter and bathroom sink using your stationed caddy, which prevents buildup that would otherwise require a much more physically demanding, deep clean later. Number 5. Stop lifting heavy buckets of mop water and start using a spray and microfiber method instead. Ruth, 72, from a small coastal town in Oregon, used to fill a large mop bucket, carry it across her kitchen, and empty it afterward, a task that had become genuinely difficult given her arthritis and some ongoing balance concerns following a minor fall the previous year. Here's the biomechanical issue at play. A filled mop bucket can weigh well over 15 pounds, and carrying this kind of asymmetric, sloshing weight requires significant grip strength and core stabilization to prevent spills. Precisely the kind of demand that becomes riskier as grip strength and balance reflexes naturally decline with age. Additionally, mop water on tile or hardwood floors creates a genuine slip hazard, compounding fall risk at exactly the moment your hands are full and your balance is already challenged by the weight you're carrying. The fix eliminates the bucket entirely. A spray mop, which dispenses cleaning solution directly from a refillable reservoir in the mop handle itself, combined with a washable microfiber pad, allows you to clean floors without ever lifting or carrying a heavy, sloshing bucket. You simply spray small sections as you go and wipe with the mop head, replacing the pad when it's soiled. For preparation, keep a spare microfiber pad or two on hand so you can swap a soiled pad mid-task rather than needing to stop and wash one out immediately. For synergy, pair this with cleaning in smaller sections, focusing on just the areas that see the most foot traffic, like the kitchen and entryway, rather than attempting your entire floor in a single session, spreading the task across a few shorter sessions throughout the week instead. Number 4. Stop pushing a heavy, corded vacuum across your entire home in one session, and start using a lightweight robot vacuum as your daily first pass instead. Harold, 78, from a small town outside Des Moines, Iowa, told me that vacuuming his whole house in one sitting left him needing to rest for the remainder of the afternoon, and he'd begun putting the task off for weeks at a time, allowing dust and allergens to accumulate in a way that was actually affecting his breathing. Here's why this matters specifically for a body dealing with pain or limited mobility. Pushing a traditional vacuum requires repeated forward lunging, shoulder engagement, and core stabilization, sustained over what can be 20 or 30 minutes of continuous effort for a full home. For someone managing joint pain, this sustained repetitive strain can trigger a flare-up of inflammation in already vulnerable joints, since inflamed tissue responds to repetitive mechanical stress with increased swelling and discomfort, sometimes lasting days after the activity itself has ended. A pattern many patients describe as a task not being worth it the next day. The fix isn't to eliminate vacuuming, but to let a robot vacuum handle the daily maintenance pass across open floor areas automatically, reserving your traditional vacuum, or, better yet, a lightweight cordless model, for occasional deeper cleaning of corners, stairs, and upholstery that the robot can't reach. This can reduce the physical vacuuming burden on your body by a significant margin, since the majority of daily dust and debris on open floors is handled without any physical effort from you at all. For preparation, schedule the robot vacuum to run automatically on a timer during a period when you're typically out of the room, such as during a morning walk or while you're preparing a meal, so the maintenance cleaning happens without requiring you to remember or supervise it. For synergy, pair this with a simple clear the floor habit each evening, moving any loose items, shoes, or cords out of the main pathways, which allows the robot vacuum to function properly without becoming stuck or requiring your intervention. Number 3. Stop scrubbing grout and tile by hand and start letting steam do the heavy lifting instead. Eleanor, from earlier in this video, also struggled significantly with bathroom grout, describing the scrubbing motion required as one of the most painful tasks for her hands and wrists, which had developed a meaningful degree of arthritis over the preceding decade. Here's the underlying issue. Grout scrubbing requires small, repetitive, forceful hand and wrist movements, precisely the type of motion that aggravates joints affected by arthritis, a condition involving inflammation of the joint lining that becomes considerably more common with age, affecting an estimated majority of adults to some degree by their 70s. Repetitive, forceful gripping and scrubbing can trigger measurable increases in joint inflammation and pain that may persist for days following the activity. The fix involves a handheld steam cleaner, a relatively inexpensive tool that uses pressurized steam to loosen grime, soap scum, and mildew from grout lines and tile surfaces without requiring significant scrubbing force. You simply hold the steam nozzle over the area for a few seconds, allowing the heat and moisture to do the chemical work of loosening buildup. Then wipe away the loosened residue with a cloth using minimal pressure. For preparation, use the steam cleaner while the bathroom is already slightly warm, such as shortly after a shower, since the existing humidity and warmth appear to enhance the steam's loosening effect on stubborn buildup. For synergy, pair steam cleaning with a preventive grout sealer applied once or twice yearly, which reduces how deeply grime penetrates the grout in the first place, meaning each future steam cleaning session requires even less effort. Number 2, and this is the one I promised you at the very beginning. Stop reaching, stretching, and straining for high or awkward spots, and start using an extendable, multi-angle cleaning wand instead. This tool sits unused in the cleaning aisle of nearly every hardware store, and most seniors have simply never considered it as anything more than a duster for ceiling fans. But an extendable wand with a bendable, multi-angle head, the kind originally designed for reaching high ceiling fans and light fixtures, can be used for an enormous range of low-effort, high-value cleaning tasks that most people still attempt by climbing, stretching, or bending awkwardly. Here's why this particular tool addresses such a significant risk factor. Reaching overhead or into awkward, twisted positions, especially while standing on a step stool or chair, combines several dangerous elements simultaneously. Elevated fall risk, since you're off the ground and often off balance. Shoulder strain from sustained overhead reaching, which becomes considerably more common after 60 as the rotator cuff tendons, the tissue connecting your shoulder muscles to the joint, naturally lose some elasticity and blood supply with age, and reduced depth perception for judging your footing, since your attention is focused upward rather than on your feet. Research on fall-related injuries in older adults has consistently identified step stool and ladder use for household tasks as a disproportionately common cause of serious injury, precisely because it combines height, reaching, and distraction all at once. The fix eliminates the need for climbing almost entirely. An extendable wand, often adjustable from 3 to 6 feet or more, with a flexible, bendable head, can dust ceiling fans, clean behind and under furniture, reach the tops of tall cabinets, wipe cobwebs from high corners, and even clean window blinds, all from a fully grounded, stable standing position with both feet planted firmly on the floor. For preparation, keep the wand stored somewhere genuinely accessible, like a front hall closet rather than a distant garage. So you're never tempted to grab a step stool simply because the extendable tool feels inconveniently out of reach in the moment. For synergy, pair the wand with a microfiber attachment rather than a traditional feather duster, since microfiber actually traps and holds dust rather than simply scattering it into the air, reducing the frequency with which you need to repeat the task at all. And now, number 1. The single most effective, and honestly, most underused, cleaning strategy on today's entire list. Stop treating cleaning as one large, exhausting weekly event, and start using what I call scattered micro-cleaning throughout your day instead. This is a shift in approach, not just a tool, and I genuinely believe it matters more than every other item on this list combined. Frank, Eleanor, Vincent, Dorothy, Walter, Ruth, and Harold, everyone I've mentioned today, all described the same underlying problem before we adjusted their approach. They were saving cleaning tasks up and attempting them all in one large, physically demanding session, usually once a week, which meant every single task required a full reserve of energy and pain tolerance all at once, on a single day. Here's the science behind why scattering these tasks throughout your day and week works so much better for an aging or painful body. Chronic pain conditions and inflammatory joint conditions typically follow what's sometimes called a use-dependent pattern, meaning symptoms tend to flare with sustained, concentrated activity, but often tolerate brief, interrupted bouts of movement considerably better. Additionally, sustained physical effort draws more heavily on anaerobic energy pathways, the short-term energy system your muscles use during intense, continuous effort, which produces byproducts like lactic acid that contribute to the burning fatigue you feel partway through a long cleaning session. Shorter, scattered bursts of activity, by contrast, allow your body to rely more heavily on your aerobic energy system, the more efficient, sustainable energy pathway that draws on oxygen and doesn't produce the same rapid fatigue, essentially letting your body's power generators, your mitochondria, operate in their more efficient gear rather than being pushed into an inefficient, high-strain mode. The practical implementation involves breaking your usual weekly cleaning list into 5 or 6 small tasks of 5 to 10 minutes each, scattered across your day rather than concentrated into one session. Wipe the bathroom counter while waiting for your morning coffee to brew. Run the extendable wand over one shelf while a meal is cooking. Spend 5 minutes with the spray mop on the kitchen floor in the evening, rather than an hour tackling the entire house on Saturday. Each individual task feels genuinely manageable, causes minimal cumulative strain, and, remarkably, research on habit formation and consistency suggests that shorter, more frequent tasks are actually completed more reliably over time than large, dreaded sessions that are easy to postpone indefinitely. For synergy, pair scattered micro-cleaning with every other item on today's list: the long-handled tools, the stationed caddies, the spray mop, the extendable wand, since having the right low-effort tool immediately accessible is precisely what makes 5-minute cleaning bursts realistic throughout a busy or painful day, rather than requiring you to gather supplies each time, which quickly undermines the entire approach. All of the research I've referenced throughout today's video, along with more detailed guidance on adaptive cleaning tools and techniques, is linked in the description below, so you're welcome to look into the specifics yourself and discuss anything relevant here with your own physician or physical therapist. Before you go, I want you to really sit with something. Independence isn't only measured by the big, dramatic milestones we usually talk about on this channel: walking further, standing steadier, staying stronger. Sometimes independence is quietly measured by whether you can keep your own home clean and comfortable, on your own terms, without pain forcing you to hand that responsibility over to someone else before you're ready to. Frank, Eleanor, Vincent, Dorothy, Walter, Ruth, and Harold all started exactly where many of you might be starting today, exhausted by tasks that used to feel effortless, quietly wondering if giving up on doing their own cleaning was simply an inevitable part of getting older or living with pain. It isn't. Every one of them found their way back to a clean, comfortable home, and real confidence in their own ability to maintain it, not through gritting their teeth and pushing through pain, but through smarter, gentler methods suited to where their bodies actually are right now. It is genuinely never too late to reclaim this particular piece of your independence, no matter your age, your diagnosis, or how long it's been since cleaning felt easy. If this video gave you something useful, please subscribe to this channel. I make these because I believe every person managing pain, disability, or the simple realities of aging deserves practical, honest information, not just vague encouragement to push through. And I'd love to know in the comments, which of these 10 hacks are you going to try first, and which cleaning task has been the hardest for you personally? I read every single comment, and I'll see you in the next video.